But that's all you really need to do. You don't need to be thousand products. That's not necessary.
I feel shamed now because I normally go to sleep in my makeup.
Yeah. I used to do that. But it's the worst thing you can do.
Well, I won't do it anymore, obviously. I've just been frantically taking notes of what I'm going to go down to Boots and buy.
Yeah. That's good.
Welcome to the Joy Tuck Club, the podcast that celebrates the beauty and diversity of transgender individuals and identities. I'm Rachel, my pronouns are she, her, and with me is my wife and co-host, the lovely Phoebe.
Thank you. Also she, her.
What are we doing today, Phoebes?
We're measuring our microneedles, conserving our collagen, and saving our skin while we chat with the laser-focused and quite lovely Lisa Lefever, owner of Clinic Lefever, a place world-renowned for its scar treatments, medical pigmentation, and cosmetic permanent makeup.
You sound a little hot and bothered. Have you caught a Lefever?
I think I do. She shares things I truly wish I'd known prior to my own surgeries. Things to do just 24 hours prior that help with healing and scar reduction.
Oh, definitely, I agree. The entire interview is an eye-opener. Not bad for the fourth in our gender-affirming care series.
Oh, yes, it's a great interview. You could almost say she really left a mark on us. Since the interview, we've taken her advice to heart.
Or face.
And changed up our routine. Our skin has never looked better.
We're positively glowing. Exciting, isn't it? So everyone, let's sit back, relax, and join us in the Netherlands with Lisa Lefever and her angels.
An interview where we learn beauty is deeper than the dermis.
So welcome, Lisa. Thank you for joining us today.
You're welcome.
If we could start with a little bit of background information, how you got into the scar business.
Right. Well, I've been in the cosmetic industry, I think, for, I'm not going to say how long, but a long time. So more than 25 years, let's say. I was more really on the cosmetic side beforehand. And I had a nanny looking after my children, and she developed breast cancer. And I thought at that moment, I'm going to switch course and I'm going to help. I wanted to help people with cancer. So I started looking into things that I could possibly do that would be beneficial. And I thought maybe I would go into wig making. But as I'm a very impatient person, I decided 3 months to make a hairpiece was not something I could physically do. And my mother saw on television a program about somebody having an areola tattoo, to have their nipples tattooed on. And at that moment, I thought, yes, this is actually what I'm going to do. And I think a month later, I flew to London and I was registered in the Royal College of Surgeons in one of their training academies.
Wow.
And from that moment on, really, everything sort of developed in, I couldn't understand when I learned to tattoo these areolas, and I just couldn't understand why nobody was dealing with the scar tissue behind the areolas, because, of course, we were getting a lot of problems with retention of pigmentation, because, of course, the skin is like, it's had, it's got scar tissue, it's the radiation, the skin is very thin. So then I started looking into ways that I could improve the skin. And of course, then from cancer patients, it went to trauma patients, and it just sort of developed more and more. And I thought, I can help that person. I can help that person. Yeah, so that's basically where it started, really. I think around 16 years ago, I got into that avenue of working with pigmentation and scars. And there really wasn't anything on the market at the time. So I had to learn myself. So going to different conferences, going to talk to doctors, because, of course, I come from a different world and doctors don't usually talk to me. They're like, oh, she's, not one of us. But, of course, I make myself known, and I started going to these different conferences around the world and meeting surgeons, and then explaining what I could do for their clients.
Yeah.
One particular case was a lady that had a bomb explosion on her face. And Bridget Meyer, one of the surgeons that I work with, did an amazing job of reconstructing her facial features. But of course, the tissue was so tight that she had no movement. So I started doing different microneedling, laser treatments, recreating the lip shape of the lip. And of course, I wanted to talk to Bridget again, and I couldn't get through to her, you know. So I said to my client, okay, let's make an appointment by the hospital in your name. We will go together and I will show her what we've achieved. So that was a huge change for me when we went, and the doctor couldn't believe what I'd managed to achieve. So then after that, she started sending me a lot more clients. And Bridget Meyer is one of the leading surgeons in facial reconstruction in the Netherlands for the trans community. So, you know, then we started looking at the possibilities of using pigmentation to the face to increase or improve the feminine features of the face by using skills that I knew. So where Bridget, you know, did her bit, I was like the cherry on the cake for the scars, or just giving a little bit of extra volume or lip lift. And it was a magic made, you know, a marriage made in heaven, really. The two components, and of course the facial team I met years ago. I met the facial team, I think, in their very, very early days in a hotel in Amsterdam where they were doing, you know, meetings with potential clients. And I met Lilia, and I explained to Lily, you know, all the things I could do. And she said, oh, I would like to meet you. And I think the week after, they were in London doing their first ever one of their first ever meetings, you know, as a facial team with their clients. And I said, I'm coming, I'm flying. So I just sort of flew there, and I met all the doctors. And from there, you know, that relationship grew and developed. So, yeah, that's basically how I got into this field.
You both share the common motivation of simply wanting to help people, which is wonderful.
Yeah.
It's just very pure.
Thank you so much. Yeah, I also do it selfishly for myself, because I get quite a great feeling when, you know, I help somebody. I feel I've achieved something. So it works both ways.
Without taking you back to the Royal College necessarily and taking us through the training, can you start with the basics of why do we scar? And then how do the different treatments help to resolve that?
Okay. Everybody is a unique canvas. So in our healing process, some people will tend to make too much collagen, where the other people may not make enough collagen. This is in very simple terms. Some people heal quickly, some people heal too quickly, and some people heal too slowly. So, and of course, we've also got factors included in the way we heal, whether it's our lifestyle, it is how we look after the scar after surgery or of a trauma. How we actually look after that has a huge factor to play in how we're going to heal. For instance, if somebody has breast augmentation and they sleep on the sides, well, then you have more pressure on one side of the body. So therefore, the scar can open. So you can have a much wider scar than if you were taped or bound for a much longer period. So it's very difficult to say one instant why somebody would get keloid scarring and why somebody would get hypertrophic scarring or atrophic scarring. So it's very unique to that individual person, what sort of scar they will have. You know, if you have a darker skin, you've got much more a darker skin. And I do not mean to be crude or when I say this, but a darker skin stays much more beautiful, much longer, because it has so much more collagen in the skin.
Oh, it's interesting.
But because it has much more collagen, in that healing process, you tend to have keloid scarring, which is a much raised scarring. So for somebody with a scar it's not great, but for somebody to look young, that's what you want. It's the same with a female skin has much less collagen than masculine skin. A man is born with more collagen, a much thicker skin. That's why you always see men as that they age with great legs, but women tend to have that very crepey, thin looking little legs, because as we age, we lose so much more collagen, whereas a man retains its collagen much more. So there's some of the factors why we would have scarring and different types of scarring.
One of the effects of HRT for trans women is a thinning of the skin.
Correct.
Is that collagen making a rapid departure?
No, you're born with a certain amount of collagen in your body. So as we age, we deplete the collagen. So actually, HRT it does have an effect, but it does stabilize us as women, because I'm on HRT as well, to stabilize, to withhold a little bit more collagen. So no, not really. I mean, no. It's not going to affect.
No.
It's not going to affect you in any way or form. No.
Are there any scars that you can't treat? Are there any particular type of scar that don't respond well to treatments?
Correct. Yes, there is keloid scarring. There is treatments. The latest types of treatments for keloid scarring is cryotherapy treatments. It's where they freeze the scar, because most of the treatments I do is either a laser or a sort of microneedling treatment, which is precision trauma to the skin. So we are recreating the trauma, but in a minute scale. But with keloids, in that healing process, will create too much collagen. So even if it's on a very controlled trauma, you can encourage that scar tissue to keep growing. So the only way you can really improve keloid scarring is to use freezing, and maybe some cortisone injections. But that's the only type of scarring that I would personally say, no, you need to go to your surgeon or a specialist to have that type of service, because of course I wouldn't want to make it worse.
And does the type of scar depend on the type of canvas you have? What is it down to the person?
Yeah, absolutely. You know, I have by myself very thin skin, I've got to say. So I would have, generally speaking, somebody with my complexion would usually have a very thin white scar. You have a thicker skin than me, so maybe your scarring would be slightly more raised, possibly.
Well, we're trans. We have to have thick skins.
Yeah, that's true. That's true. So, but yeah, it really is the canvas, and it's the healing. It's how you look after the scar. You know, I do a lot of scars on the frontal area here that I see, you know, that they open up a lot because there's a lot of pressure. If there's a lot of movement, then there's pressure on the area. So scars will tend to open. They will, because the skin is weaker, and a scar can actually take up to 2 years to heal, really. So that scar will never become 100% as strong as it originally was, the skin. So with all services that we can provide, you speed up that process, and you create a stronger foundation again. But you'll be lucky if you can get to around 85% strength of the original tissue. Yeah.
Is there a time limit on treating scars?
It doesn't matter if they're 20 years old, 30 years old, 40 years old. I can absolutely make a difference. How much of a difference is, again, individual to the client.
There's no term limits on a scar.
No.
No.
Because you're creating a new trauma in the skin. So your natural healing ability is kicked into place. So it's a new trauma to the area. So your body is like all those little soldiers need to start working, because they think, oh my God, it's a new trauma. But I will say something. If you do decide to go forward and have a procedure done, scars hold a lot of emotions. And I find that when I work with my clients, especially the first time I work in the scar, most of the time we have quite a lot of crying, because I start working and that emotion from that time is locked into that scar, and then I start working on it, and it sort of seems to either trigger a memory or a feeling, and it just tends to come out, which is a good thing, but the client has to be prepared for that. I mean, really, you when you start working in a scar, it can be quite bloody, if I'm honest, because you're creating a trauma, so you have to look at that for a few days. So, you're always reminded. Yesterday we had a young man that he self scarred on his arms, and every time he comes in, he's reminded. But it's a great journey to see how that person is getting stronger and stronger, and to watch those scars every month diminish. It's wonderful. So it's a whole process. And that's, I got to say, that's probably also why I like working in the trans community or with my trauma patients, is after surgery, sometimes you feel, okay, I've done my surgery. Now what? What do I do now? It's like a sort of time where you think, okay, that's all done. Check, 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 check. What do I do? So it's really nice if a doctor can maybe introduce you over to somebody that can let that journey continue a little bit longer, so you can work on the scars, work on other things, so you don't feel so alone. And I don't mean it's just nice. We find a lot of our clients love to come to the clinic, and they love not finishing the journey, if I'm honest. They, every time they see a little improvement, or we do something with the lip, or we do this, and it's just a nice ongoing thing. So for both of us, we both.
So
Yeah.
So would you say then that you take your patients on a journey that is not just skin deep?
Correct.
It's a journey of mental healing, of healing from trauma, of recovery,
Yes.
of progress in all sorts of ways, mental and physical.
100%. We put so much time into those types of procedures, but not just procedures. We build up a friendship with our clients completely. Sometimes they arrive at 11 o'clock and they're still here at 6 o'clock in the evening. Yeah, quite often, because they like to talk to the other clients, and then their stories. Then and we love
We should
that.
come visit.
Yeah, we love that. So, and I have a charity that we are developing, and because a lot of people in the trans community don't have a lot of money. So, and I have an academy upstairs, and I teach these skill sets. So we've sort of created a sort of the two-way thing from the hospital. So Bridget now sends me all her clients. Some that are financially okay will pay for the service and come to me. But some clients that don't have the money, then I say, no problem. We have an academy upstairs. Let me use you as a model, and our students will work on you. So it's win-win for everyone. So the clients that can't afford it, they get the help they need. My students get taught these important services, and everyone's happy. Yeah.
Oh, that's great. That sounds lovely, doesn't it? You've kind of led me on to a question that we were going to come to later, but I think the timing's right to ask it now. If someone can't afford any of your treatments, do you have any recommendations for how they could look after their scars, and any particular products that they can get over the counter or anything?
There's some different, depending on the scar. I could absolutely give the client some personal advice to that scar with products, or maybe different types of services that they could actually do at home. But again, we are developing this charity where we want to have a Lefever angel all around the world offering these services, and the charity hopefully will pay for the services in the individual clinics. So that's what we're trying to achieve right now. So anybody that does my training has the right to become a Lefever angel, and we've now got angels in Norway, in London, in America, the UK. We have a couple now. So we're growing our base, and I hope to increase on that much more in the coming years.
That's quite fabulous.
Thank you.
How long have you been running the academy then? When did you launch that?
Well, 5 years ago, just before Corona, I started this academy in school, 6 months before Corona. So it was quite a challenging time, but we made it. So,
Oh, yes.
yeah, through thick and thin. It's never been about money for us. So the monies came, but it was never the initial reason to do it. It's a lifestyle. Yeah.
Well, it's always, isn't it? If you do something, do it well, then the rest follows.
Yes.
What sort of complications does someone face if they leave a scar untreated? And I imagine some types of scarring is worse than others.
Well, yeah, I have. It depends again on the scarring, but if it's on the face, for instance, we had a gentleman that contacted us a couple of months ago. He wanted to know how much the procedures was, and he's been to all the different surgeries. He's had so much done, and nothing's working, and nobody would help him. The insurance don't. And he said, and he's a gentleman with colour, and he said, people are scared of me because I have scars all over my face, and they think that I've been with a knife or something, but it was a car accident. So it affects him in every form of his life. So I said, if you can't afford it, don't worry, you come to our academy and we help you. And he's now had 2 procedures, and we can already see a huge improvement in his face. And he says, I can actually now feel that I have a chance for a better future because nobody's going to be judging me because of my scars. And people judge. They assume. It's, we look at somebody and within 5 seconds, we've already made a judgment on that person. So, yeah, scars can have a really huge impact on people's lives.
Yeah, and the sort of assumptions they're making in that case takes several levels of racism.
Yeah.
Wow.
Yeah, and I mean, also I have a lot of clients that have had facial feminization surgery that wasn't really as it should have gone. We see a lot of scars on the lips and on the face, and and I say every scar is a tell. So we don't want scars, and sometimes they're quite horrific, the scarring. I've seen where there's permanent filler here, where they've done implants and stuff. So for somebody looking in the mirror, a tiny scar that's like this can be like this in somebody's head. So mentally, it has a huge impact. So if we can reduce the appearance of a scar, you're not confronted every day, and people don't make assumptions. So it makes a huge difference for people if we can reduce that.
So browsing your website, your clinic has what seems to be fairly fancy tech. But can we dive into some of those treatments? For example, the Origin laser LED therapy, Reverse RF treatment, and how they work to improve scars?
Yes, let's start with the microneedling with radio frequency. Now, that is a machine that has 63 needles on a plate where the radio frequency goes through the needles and goes under the skin. That is a great treatment if somebody wants to look young, wants a very tight skin. It works on scars that are large. So if it's a large area, then I would use that type of machine, because you've got the microneedling, you've got the radio frequency, which will go under, will tighten the skin, and it warms through the skin. So it doesn't leave you bloody. So some of the procedures I do leave you bloody. So with the microneedling with radio frequency, not, because of the heat that goes through the needles, is like a sort of cortisone type effects. So you look very normal when you leave. So again, I would use that for maybe stretch marks, maybe body surgery, where, you know, it's a large area. Lead therapy. Now, lead therapy is something that they use in NASA. You know, they use it for astronauts to heal the skin. It's scientifically proven to make a dramatic difference in the healing process. So if we're doing a service such as microneedling or radio frequency, I will always use my lead therapy in combination. So you use the microneedling, radio frequency, and then I will get my lead therapy. What a lead therapy does, I'll go back a bit. If you're under a sunbed, you activate the melanin in the skin, so you would be brown. But what our lead does is it goes through the skin and it activates the cells. So the cells inside start to shake and they multiply. So even though you don't feel anything happening, it's a very, very, very strong and useful tool. So this is something I want to implement in Marbella with the facial team, that every client that has FFS will come to me and we do the microneedling and radio frequency, and they go onto the lamp directly after surgery to speed up the healing. Mm-hmm. The Origin laser is a mirror laser. Now you've got CO2 laser. It's quite an abrasive on the skin, so you walk out of the clinic looking a little bit like a mummy. With our laser, microneedling works from inside, and the laser works from outside. So it can be very useful for certain types of scarring or fine lines or tightening or pigmentation, because sometimes with scars you have different pigments that need to be adjusted. So with using different types of machinery, I can get the best results. So sometimes I will choose all three or all four in one sitting. Sometimes I will just use manual microneedling, which is a tattoo pen with a needle. If the scar is really hard, then I will go with the needle into the scar, and I will make sure that the scar tissue breaks. You feel like loosening, because the scar can also be very tight on the skin. I see a lot behind the ear after the surgery, that you have a very hardening scar around this area. Mm-hmm. Now with microneedling, that reduces that and breaks that scar tissue down, so people get a much more softer area around this area. So yeah, different techniques are good for different surfaces. And it's and again, every time I see a client, I will probably change my my action. If I think, oh, that didn't work quite as I like, then I'm going to think, okay, I'm going to try this now. So different machines and different services work in different ways to achieve the best result.
But do they all stimulate collagen? Is that the basic?
Well, yeah, stimulate collagen, break down elasticity, make new elasticity, break down scar tissue, because scar tissue can be hard. So I see it also, and sometimes scar tissue is invisible as well. With certain surgeries, I get a lot of clients that have a very tight chin because of the surgery that they've had. So we do microneedling on this whole area to break down the scar tissue. So there you don't necessarily need the collagen. You want to actually break down the scar tissue. Collagen is always good because it just heals, and it's, you know, healing its food, you've got to say. But sometimes we want to break down that scar tissue, and then I would probably do it manually with a sort of tattoo gun and with a needle, and I will go into the skin and actually get into that scar tissue and break it.
Wow. So it sounds invasive. I know it's not, but just as a reference point, do you only deal with the epidermis, or do you go...
No, I go deep.
Further. You go...
Yeah, deeper.
Down through the basal, down into the dermis. What about this? What is it called? The
subcutis. Yeah. I need to, if you think of a scar, and you've got different types of scarring. So you've got, let's just talk about an acne scar. Well, that sometimes it's just on the surface of the skin. So then I just need to work in that area. But if we're talking deep scarring, I have to go all the way through to the scar. Otherwise, we're just going to work here. And what about down here? This has to heal as well. So I want to get right to the point of where the scar tissue is and work. So, that could be 3-4 millimeters deep. That's quite deep for a scar.
How do you tell when people have different skin thicknesses?
It's something you learn over time. It's a feeling. And because I usually see my clients for a period of time, I don't go in like with a chainsaw to start with. I work softly and we figure out each other. I don't want to make things worse. So slowly is the best course of action. Start slow, gradually heal the skin, then again. So it's something that it's like an artist. It's like something you have to have you learn a skill, but you have to have that special feeling,
The touch.
Yeah. So it's something I can't, of course I can scientifically tell you, where you need to work, but sometimes I need to think out the box and I think, okay, if I do this and do this, I'll get some better results. Yeah.
So I'm guessing that as you said, people are different, scars are different, so there's no real hard and fast rule to how many treatments they're going to need.
Exactly.
Yeah.
And this is really the thing. I mean, I usually have a good idea if I can see the skin on somebody. If you've got a good thick skin, usually can get, great results. If it's a thinner white line scar, they're the hardest to improve. But yeah, it really is. It's the canvas is the main thing. It's just the canvas, the tools, the technique. It's so many factors that come into play to get the best results. But I usually say to my client, let's just, before we get any high hopes, let's just do 3 procedures. And then I have a better idea where we're going to go, and then I can see how the skin's healing. Yeah. And again, I have clients that come to me for 2-3 years that have got scars. Maybe not every month, but they still come to me because they can still get improvements. So it's something that they think, oh, okay, I'll make that part of instead of a facial, I'll go to Lisa 3 times a year and work on my scars because it's an ongoing process. So yeah, it is very individually based.
How far apart are you able to have treatments? Is there a time, like if I have laser hair removal, I've got about 6 weeks between treatments. Is it similar for you?
It's about the same, 4 to 6 weeks. Yeah. Give the skin time to heal, but you've got to think that a scar can take up to a year or 2 years to heal. Let's say after microneedling. So even after you've done that procedure, the effects go on much longer. So usually I say to the clients, don't forget what we do now. Over a year, you will have the maximum benefits from because it still works. You're still healing from what I do today. Yeah, everybody is individual. Everybody will get different results. Sometimes I'm flabbergasted at the results I get, and sometimes I think, I wish I could have done better, if I'm honest. So yeah. But I do like a challenge. So if I think something's not working, I will always try and think of something else.
Is there a common thing you say to new clients when they come to see you for the first time, and it's, oh, for goodness sake, why did you do that? Or is there advice that you would give to everyone after surgery, for example?
Well, my advice to anybody that's going to have surgery is to find a specialist that can do these procedures immediately after or even before. Prepare your skin before for surgery. It will just make a huge difference on your end results. It's like people that have facelifts, but they don't look after their skin. So you're just pulling that thin skin back. Well, you want healthy, thick, glowing skin, and then you get much better results. So if it's possible, then try and find some of these services in your local areas and find a provider, a good provider, somebody that's recommended by your surgeon that can actually work in the scars after surgery. like after the stitches are removed. So you can speed up that process, and you've got somebody that can help you, be aware of how you're healing. Okay, maybe we need to try this. Maybe we need to try that. Maybe you need to tape a little bit better. Maybe you need to use something when you're sleeping. Maybe you need to wear a body garment. This is the sort of thing that I would really like to see become more like a rules, let's say, like a rule that, once you have a doctor, you have somebody that will look after your healing process a little bit. Because generally a surgeon is there to do his job, like a mechanic, but he's not going to he's not going to polish the bonnet, so it's yeah.
I love that analogy.
I just figured it out.
That's great.
But that's a little bit what I think really should be happening more and more with surgeons. Surgeons should be working with estheticians or people that can do these types of services after surgery.
But you said also prepare the skin before, for example, for a facelift. So you often hear people, they look at a woman and say, "Oh my God, look at her, she's 80, and look at her skin and so forth." And I need to know what surgeon she has, but it's not about the surgeon, is it? Not necessarily.
Surgeon has a huge factor also in this. So
okay, strike that.
yeah, but it's a choice. But of course, if you're going to look after the skin, you're going to get the best results possible.
So what is the pre-op procedure someone should follow in going to someone like you? What needs to be done?
I would recommend any type of laser, no CO2 lasers, nothing too dramatic. Microneedling, but only microneedling with radio frequency. You don't want to be using the old-fashioned microneedling. You want something that is microneedling with radio frequency, that is very clean, that doesn't, disturb the upper layers of the skin. A mirror laser, something that's a very soft laser. Just something where, again, is going to increase the collagen level in the skin. When we hit 40, our collagen sort of depletes like this, it goes down. What we want to do is we want to get our collagen level up so you're already in a state of healing when you have surgery. So your body is in this, I'm looking after myself, I'm healing. Then you have surgery and your body's already healing. So your skin is already healing beforehand. So it just means that the healing process is quicker and much more efficient.
Does that mean if they can't see someone like you, they should just use retinol daily? Or
everyone should use retinol. Everyone should use retinol. Everyone should use vitamin C. It should be a standard. It should be vitamin C in the morning, retinol in the evening, a good sun cream with a factor 50, factor 30. Should be using it every day. And you should be cleaning your skin morning and evening. And so it's really, you don't need to use too many products. There's everything on the market now, this peptide, that peptide, stem cells, and they all help. But the most important is you clean your skin from all the factors of the, outside. Mm-hmm. You're using a vitamin C every morning. If you use a vitamin C, that keeps our skin young and healthy. And a good day cream with a factor 50. In the evening, skin cleaned, retinol, and a good hydration cream in the evening, because of course retinol is drying, so we want to use something that is a moisture bring into the skin, something with hyaluronic acid or something. But that's all you really need to do. You don't need to be thousand products. That's not necessary.
No, I feel shamed now because I normally go to sleep in my makeup.
Yeah, I used to do that, but it's the worst thing you can do.
Well, I won't do it anymore, obviously. I've just been frantically taking notes of what I'm going to go down to Boots and buy. Yeah. That's good. So we've spoken about the treatment, but are there any aftercare recommendations?
Yes. This product here, which is Clinicept, it keeps the wounds clean, and it also speeds up the healing process. So I'd recommend definitely using something like this after surgery. And at a later date, then we can talk about other products. But at the moment, hyaluronic acid, and this is really all you need. A good, in the first stages, you don't want to be putting hard products. It could actually irritate the skin. So just simple for the first 2 months after surgery, just healing, keeping it clean, and that's all I would recommend. In the future, you could think about using some retinols, some vitamin C, some peelings, but that depends on each individual case. So I wouldn't like to say now use all those products.
There are lots of surgeons, and they all seem to have their own opinions on their post-op instructions.
Correct.
Do you have a recommended post-op regime that would minimise scarring?
Pre-preparation of the skin, absolutely. I go to all the congresses around the world with all the latest techniques and research in scar improvement. And it's scientifically proven if you work in the skin before surgery, even 24 hours before surgery, you will get better healing results. So this is something that I would extremely recommend, the right services. And again, after surgery, the lead therapy and the microneedling once the stitches are removed will ensure a much less visible scar.
Cool, thank you.
You're welcome.
Sorry, just recapping. So before surgery, some sort of laser treatment,
yes,
but not the CO2, not the ablative.
No.
Laser. Yeah.
We don't want anything too heavy. We want something that's soft, but just encourages the healing process.
Right. And every trans femme who grew up being taught nothing about skincare, get with the program.
Exactly. Yeah.
I think this is where you also see some of the mental health benefits, for example, gains in self-confidence.
Absolutely.
Absolutely. And so someone's face appears more alive and healthier if they're not feeling terrible about how they look.
Exactly. And well, I have to tell you, because I invented a training called Trance and Trauma. That is going to be, we start next year, and it's teaching healthcare medicals or people in my field how they can help people in the trans community or somebody that's had a trauma with these techniques. But in the training, we're also going to talk about the mental state of our clients. And, if we are working with our clients, the importance of understanding what that client has been through. So I'm going to teach them everything about all the surgical procedures that a client has to undertake and the problems that occur. I mean, you don't necessarily have people that can talk to you about these things, in the medical. So I think it's important for people that are working with the trans community that can help the mental side of this thing, and to be able to be a support for your clients and understand what you go through. It's just as important as knowing how to do the services, I think.
I think you're setting an example on being a fabulous ally, because you're not just there support, you're being for a sort of passive support. This is very, very active. If someone is interested in attending your academy or joining this cohort, what do you recommend they do? How should they go about it?
Well, they could just send me an email, really, and let's see because we have people coming from all over the world. And next year we're starting these trainings in France. Actually, we just got today, a school has asked us to do our trainings in France, in Paris next year. So I hope again to be all over the world offering these services. So watch this space. So I think just send me an email and let's see how I can make it work for that individual.
Well, I might just be doing that then.
Oh, nice. Yeah. Yeah. Well, we do teach, of course, I'm in the Netherlands, but we do have trainings in English for our foreign clients. So, yeah, that sounds really good.
Well, thank you. You've zipped through our questions. It's been incredibly informative. And I've got to say, you're dealing with two people who, approaching this interview as we were thinking what to ask, we were talking about microneedling. And my idea was that it was a whole series of tiny aggressions.
I thought it was darning very small socks.
Oh, yeah. Yeah.
So you've opened our minds and our pores,
Oh, thank you.
cleaned our skin and our misconceptions, and
It's really nice.
done an absolutely wonderful job. Thank you so very, very much.
You're welcome. Yeah, thank you so much.
Oh, yeah.
Really. Thank you, girls. Thanks very much. Have a good day.
Thank you, Lisa, and
Bye.
you. Bye-bye. What a fabulous interview. I learned so much. I was really surprised. It's full of useful info and tips. And speaking of which, I'm tipping this to be one of our most popular episodes.
Oh, yeah?
Yeah.
Me too. I really did have no idea that having a skin treatment within 24 hours of surgery would optimize the outcome, but it makes such good sense to prime the skin's natural healing in advance.
I know, right? And we, the patients, quite literally have our skin in this game.
We do.
So it's nice to know that we have someone like Lisa Lefever strong-arming her way into the sector and educating surgeons as well, when none, initially at least, would talk to her.
I also want to add that she's so intent on spreading her knowledge and other skills through her Angels program, spreading her wings, should we say.
Very good.
It's quite remarkable. It seems to have so much potential, and I want to race across the Netherlands and sign up.
Okay, I'm coming with you.
Okay.
But when it comes to cleansing and moisturising, Lisa has shown us there's more than one way to skin a cat.
Oh, God, meow. Yeah. So that's a wrap for this episode of the Joy Tuck Club. We want to thank you, our listeners, for tuning in and being part of our community. If you want to connect with us further, please visit our website, redandfreckles.com, where you can keep up to date on all things red and freckly.
You can also follow us on Blue Sky, Threads, Instagram and Facebook, but not Twitter. We use the handle @2damptrans, all words, on all platforms, and you can DM us if you have any questions or topics you'd like us to discuss.
Right, and also don't forget that this is part of a series of interviews with the absolute top professionals in the field of gender-affirming care. Surgeons, therapists, the lot. So you can find them all on Spotify, Apple, YouTube, or wherever you listen to podcasts under the Joy Tuck Club. You'll find us on all the popular platforms.
And as always, even some of the unpopular ones too.
Still that. We appreciate your feedback and support.
So share us, spread the word about the Joy Tuck Club.
Yeah.
And so until next time, remember you are valid.
You are beautiful.
And you are transcending boundaries.